been asked to give an overview of what electronic health records are, the primary components of an EHR, and their related benefits and potential issues. So let's get started. What is an EHR? In its simplest form, an electronic health record is health records of a patient in electronic form. There are also other forms of terminologies that are associated with an EHR, and those can be EMR, electronic medical record, CPR, computer-based patient record, EPR, electronic patient record, and PHR, personal health record. An EMR, electronic medical record, is often used in conjunction with an EHR, but an EMR is more described as a point in time, as the EHR is the overall health picture of the patient that contains all the electronic medical record activities. So what can EHR systems really do for us? There are core functions in an EHR system that it should provide. Those functions are health information and data, workflow, interaction, clinical, patient support, messaging and data, and admin tools. So let me just go through a brief explanation of all those that electronic health records should do for the office or for the medical group. So health information and data. This means it should house all the patient's health information. And examples would be allergies, lab results, medications, diagnosis, and clinical care instructions are just some of the examples that are housed in electronic health record. Workflow. This one is very important. The EHR system should be able to flow into the current system we have today. The system should be able to replicate our daily tasks and make them even better than they are currently today. Interaction. The electronic healthcare system, the electronic health record system needs to be user-friendly and should be saving time and money. That's the objective. To make the system, make the office function flow more smoothly. Clinical. The EHR system should provide clinical decision support. Examples would be prompts and alerts with regard to patient safety, guidelines, and preventative services. Patient support. Giving patients more information involvement in their care. This means assisting the patient with their chronic health conditions. Examples would be high blood pressure, diabetes, and those sorts of things. Messaging and data. Electronic health records should be able to exchange data with other healthcare applications. And an EHR should be able to receive data in multiple formats as well. Some EHRs can interact with patient portals and message a patient with alerts for appointments, reminders, medications, lab results, and even lab tests. Admin tools. An EHR should be able to help streamline admin processes and clinical practices, and most importantly, the timely servicing of patients. This means no more paper in the office and no more pulling paper charts and less medical errors, especially when it comes to billing. So, how can an ER help support direct clinical care? A couple of those components that can help are quality of care, reduction of medical errors, and with quality of care, the EHR can help clinicians with specific guidelines of care. We expect clinicians to know everything and not make mistakes. And with an EHR helping the clinician, there is the potential for less errors, and thus helping the patient with care. An EHR can also help with the quality of care by telling clinicians what recommendations they should be recommending to the patients, as well in the form of preventative services or even immunizations or even follow-up care. There are some issues when it comes to using the EHR. Care for patients is that many guidelines in the EHR are not scientifically based guidelines. Providers are not required to use these guidelines by law that are present in the EHR system. With respect to errors, EHRs can help by letting clinicians know what medications the patient is currently on to help to avoid any potential interactions or safety issues regarding medications or dosing limits. With respect to EHRs helping with medical errors, the system is only as good as the data that's being inputted into the EHR, meaning bad information can lead to medical errors. Trusting the source of the data is very important with regards to electronic health records. EHRs can also help with the admin process as well, which is a very important function. Some of these components in the admin process are an increase in financial revenue to do less billing errors, better accounts receivable. We also have a better handle on legal and regulatory issues in the workplace. This is because of the level of security of the EHR platform, security levels needed to review a patient's chart. The EHR system can also be used to tell when regulatory issues or guidelines have changed as well. EHRs have also shown to decrease malpractice lawsuits, and EHRs are also great at reviewing and tracking patients' tasks in the office, which is great for pay-for-performance employees. Since security falls under the admin umbrella, EHR systems are great with security and providing audit trails of individuals accessing patient charts. So this is great for knowing when employees that are not supposed to be looking at certain patients' charts, the EHR system will actually give an audit trail of who was accessing the system. There are also some disadvantages to the EHR admin process as well. Cost is one of the issues that affects with the admin process. Having to implement EHR is costly and time-consuming, which creates downtime in the office workplace. The ongoing training is another issue that constantly needs to happen for the office staff, all the way up to the provider, to make sure everyone is using the EHR to its potential to achieve optimal results for the group. Another part of the EHR is the integration of the admin and clinical areas. The effective integration of these two areas has numerous benefits, and also has the opportunity to make daily tasks easier and to make their overall workflow easier in the workplace. Some examples are when providers are updating a patient's chart, the EHR will automatically produce billing codes as the provider is updating the EHR. This has a tremendous benefit for the billing department, as this will help by not having to go back to the provider to delay any billing. With regards to communication or messaging, the patient can directly speak with the provider through the EHR platform, and providers can do the referrals directly through the EHR. No more faxing or printing referral forms for the front office or for the provider. Also, front office staff will no longer need to ask the provider what he or she has written in the chart. The EHR will dictate all information the provider has written into the EHR. This process will help errors that can affect billing and even certain tests the provider has recommended to the patients. With the integrating of admin and clinical activities into the EHR, the patient will benefit greatly. When the provider has recommendations or guidelines for care, he or she can send instructions of care electronically to the patient through the messaging, and also send reminders to the patient to schedule follow-ups or lab tests right in the EHR. The patient will also have the ability to send data back to the provider through the security messaging as well. So the patient can send back data relating to his blood pressure takings that he's been taking at home, diabetes checks, results that he's been doing at home as well. He can send those back to the provider, and that information is automatically updated into the electronic health record. So when the provider goes to check up on it, or the system can automatically flag the provider if there's issues with the results that the patient's putting into that he's sending back to the provider that's going into electronic health record. This will greatly reduce phone calls and other timely activities for the front office, with the front office taking calls from the patient with other results that they're taking at home or any other activities that they're doing. Now they can just go right online, put it into the system, and it automatically updates. So there's less phone calls coming into the front office staff. With all this information going back and forth, the information is updated in real time as well. Well, I hope this information helps you get a better understanding with some of the components in the EHR system. Thank you for listening. Please feel free to contact me with any questions. Thank you.